Namaste. My name is Chandrashekhar. I am 67 years old and a retired Canara Bank employee. And I had a heart problem. I am a diabetic since 25 years. I had a heart problem during the month of November, and I came to know the hospital through one of our friends, and we had a very pleasant experience during my treatment as well as my stay at Aster RV Hospital. And my son, who is sitting by my side, he will brief what are all the experiences we had, because I was in the ICU and all these things. So I do not know what has happened, but the entire team of cardiology, they have given me the best treatment, especially Dr. Venkatesh, and my son will speak to you regarding the experience what myself and my son they had during our stay at the hospital.
Hi, this is Anand. I work as a software engineer at Cisco Systems, and he is my father. So, in the month of November 2022, my father developed breathlessness. So, we went to local physician, and nothing was diagnosed, and he was still suffering with breathlessness. So, that is when we came to Aster RV Hospital, and we got an echo done, which revealed that he had a heart failure, and the heart pumping was very less. So, the LVEF was around 20%. So, it was an emergency kind of a situation. And at that time, Dr. Venkatesh is and Dr. Divya, they were very kind enough to treat him, and in such a critical situation, they treated him very well, stabilized him, and at that time he was not fit for a surgery, and that was a very right decision that they took at that point of time, because his condition was quite critical. So Dr. Venkatesh and Dr. Divya treated him medically, and they were closely monitoring his situation, and they were so he was stabilized, and then discharged from hospital, and was on continuous medical treatment for cardiac failure, for heart failure, and then later the recovery was on track, but in February again he developed arrhythmia, which is irregular heartbeats, and his pulse went down to 35. So again, it was a very critical situation, which was like a near cardiac arrest. So we immediately called Dr. Venkatesh, who was kind enough to pick the call at a not so good time in the early in the morning, and we had to rush him to the hospital. So all the doctors here are very approachable, and they care for the patients, and they take the call any time of the day or night to save lives. So we are very indebted to them. So at that point of time in February, Dr. Venkatesh, they stabilized his pulse. And the good thing with the cardiology department and the doctors all over here is they don't do anything unwantedly. Heart bypass is a very complicated surgery, and so they did not want him to go through it without actually finding out if there is scientific evidence that will tell whether the bypass will help or not. So the angiogram was done, and blocks were there. So at that time, they did a PET scan to see if the heart tissue can revive with the heart bypass surgery. So nothing was done unwantedly, and it was all methodical, and it was backed with scientific evidence. So once the PET scan revealed that the heart tissues can revive, Dr. Venkatesh said the heart bypass needs to be done in his case, and so we decided with going ahead with heart bypass. So there were 4 blocks. It was a very complicated situation because his heart pumping was very weak. Dr. Divakar Bhat from Cardiothoracic Division, he did the heart bypass, and since his heart pumping was very less, the surgery was critical. So Dr. Venkatesh, using all his experience, said that an intra-aortic balloon pump can be used, which will take 50% of the heart's load, and it will help his heart in during the surgery time. So ABP was inserted, and that helped Dr. Divakar Bhat in the surgery to control his heart, and the surgery went very well. So Dr. Divakar Bhat, with his magician hands, was able to do the operation very successfully. And even after the surgery, the entire ICU team, the entire cardiology team headed by Dr. Venkatesh took very good care of my father. And even to prevent any further cardiac arrest event, so they decided to go ahead with implanting an ICD, which is sort of a pacemaker and prevents cardiac arrest. So that was then implanted in another separate operation, which also went very successful and was done by Dr. Bharat. So the entire cardiology team, the cardiothoracic team and the cardiology team, they're all very approachable, very friendly. And Dr. Venkatesh is a thorough gentleman who is very approachable, very kind towards patients, and listens to all our questions and clarifies them. And his motivational talk will definitely help the patients and the attendants to get over the mental pressure. So we're very thankful to him, and it's just a God sent angel to our family. Very thankful to Dr. Venkatesh. And we're also very thankful to Dr. Divya, Dr. Divakar Bhat, and the entire cardiology team here. And if you want a place where your heart needs greater care, then Aster RV is the place to come, because it has doctors who have a healing touch with a great sense of humanity, and they are experts in their field, and it's all world-class treatment which is given here. So I would highly recommend you to come to Aster RV to get treatment from the great cardiology team here. Thank you so much.